This slideshow represents an overview of sinus rhythm. First of all, when you're considering a normal sinus rhythm, it's a classification. When you're considering sinus, the term sinus. When you're using that terminology, you are saying that the impulses originate in the SA node, and typically they follow the normal conduction pattern, meaning it's SA node to AV node or the junction, down the bundle branches and into the Purkinje fibers, resulting in atrial and ventricular depolarization and therefore contraction. It's following that normal pattern. So a dysrhythmia or an arrhythmia is the term used with all cardiac rhythms except normal sinus rhythm. So remember, the SA node is the primary pacemaker of the heart, and it has an inerrant rate of 60 to 100 beats per minute. Sinus P waves are upright, they typically appear uniform, and are usually followed by a QRS. Remember that the PR interval, intervals are travel time elements. So the PR interval represents the travel time of the electrical impulse basically through the entire conduction system. And then the result is the activity of depolarization or then contraction. Here's a little chart about normal heart rates by age. So you can see that infants have a higher heart rate normally, so that wouldn't be considered abnormal even though it's above the 100 marker point. Toddlers, preschoolers, and school-age children can also have heart rates over 100, which is considered normal for them in their age bracket. We're going to be using our rate as we go forward through some of these sinus arrhythmias so that you can determine, is it slow, fast, or normal. So let's remember that normal sinus rhythm has a rate of 60 to 90 in the adult population. You can see that heart rates fall as we get older. Throughout the presentations, we will talk about causes and signs and symptoms and interventions of these rhythms. This will be important if you're going forward to ACLS or if you're working in a clinical area where some of the signs might be significant and some of the treatments may be very standardized. This is not always part of recognizing a dysrhythmia, but it's very good information for you to have. And again, if you're going forward for other parts, this is very, very important. For sinus rhythm, of course, there's no cause, there's no signs and symptoms, there's no interventions. We're always going to monitor our patient to be sure that they can tolerate the rhythms that they're in. We're going to look at a couple of normal sinus rhythm slides so that you can see what they might look like. When you first take a look at this rhythm strip, you can see that it falls within 60 to 90 if you count across. I can see 1, 2, 3, 4, 5, 6, 7, about 7 to 8, maybe it's between 70 and 80. So it falls in the normal range of 60 to 100. I can see, let's check and see if it's regular. So if I, for instance, put a little line between my R's and I carry that line across, I can see that each QRS is spaced appropriately. So they're spaced out evenly. That's my second R, right? So I have rate, which is it normal? Is it fast? Or is it slow? This one is in the normal range. I'm going to look at my rhythm. So is it regular or irregular? And this one I can see my R to R intervals are regular. And then I'm going to look at my relationships. So I can see a P wave with the QRS on each of these complexes. Therefore, that is normal sinus rhythm with a rate of about 70 to 80. Here's a second strip. And as we're looking at this, I can see that to me it looks normal, but let's give it a whirl. And I'm going to look also at our regularity at the same time. So I can put my line up here. So this is my spacing, and I can see that that's 2 complexes, right? Let's go forward. 3, 4, 5, 6, 7, 8, and they are spaced normally as well. So this is a rate of about 80. They are spaced evenly when I do my R to R. pardon my lines, some of them aren't exactly matching, but you can see the gist of it, of how you could measure this. And then I can see a P for every QRS. So once again, that would be normal sinus rhythm. What makes it normal is the rate. So it falls within 60 to 100. That is a normal rate. It's sinus because I see a P wave for every QRS, so it's following the same electrical conduction pattern. So it's normal sinus rhythm. I hope you find the slideshow helpful, and as always, please be sure to go to the Raise Your Hand forum on our Blackboard site if you have any questions.